And now, Dr. Krieger's lecture program starts right now.
I want to welcome everybody tonight. Tonight we're going to be talking about female hormones. We're going to talk a little bit about estrogen, progesterone, kind of follow the media a little bit on hormone replacement therapy and what type of alternatives are available to you females, because there's about 45 million females that are going to be in menopause, and by the end of probably this year, probably about 48 to 50 million are going to be in menopause. So the quality and the quantity of your life is very dependent on how you manage your health and what type of choices you make in your health. So I'm up here kind of to give you some guidance, to tell you how I feel and how the health field is going, what type of things can help you with your health and pretty much help you on your journey or your path, whether it be female hormonal issues, whether it be PMS, whether it be thyroid dysfunction, whether it be fibroids. There's all second opinions to these things. These aren't, there's other issues besides conventional therapy. So, and we want to get that out, and I think alternative medicine is really growing, and I don't think it's very alternative. It's a very common sense approach, and there's a lot of science behind it. This is my next lecture that's coming out on thyroid dysfunction. It's said, as you see on that paper, that at least 60% of the population has some type of thyroid dysfunction. You might not be on medication for it, but you might be tired. You might have trouble picking your head up off the pillow. There's various signs and symptoms that go with thyroid, and it's considered one of the master glands of your body that controls all your energy metabolism. So it's very crucial to have your thyroid functioning, especially in Michigan. With the change of seasons, thyroids will change. So you'll be able to pick out those people a lot of times going from spring to summer, summer to fall, fall to winter. You'll be able to know that because the thyroid is pushed at different seasons for different purposes to keep your metabolism going. So that's what I'm going to talk about at my next lecture, and it kind of overlaps a little bit on what I'm going to be talking about tonight. Right now, I want to kind of move on to, now, this is kind of disturbing because the hormone therapy, which I'll get into what it entails, what you use, what type of medicines were, pharmaceuticals were given out, but this was a study that was stopped early, obviously. And it's kind of disturbing for me because this has been going on for 60 years. This kind of, I don't know, this study was very good, but this study should have been done a long time ago. And I don't think anybody would disagree with me. If this was your car and your car had this much trouble and things were happening with your car, mechanic would be right on that thing. He would test that thing because nobody would pay him. You can't get your car. That's the way it is for our cars, everything. But when it comes to the body, it seems like medicine is very slow. Conventional medicine is very slow to change. I'm sure there's some people in your family that might have been possibly affected by a stroke and didn't even know it, and they were on estrogen. So there's a lot of lawsuits going on, not to put anybody at blame, but when you're going to push this into the public realm, I hope that the FDA was supposed to do something about it. They've been trying to protect the public for so long. They've been saying stay away from the snake oil, stay away from the alternative practitioners, and now something like this comes up, and they've been chasing everybody else, but what's in their backyard. So that's very disturbing, and you should be disturbed on that too, because that entails birth control, anything with estrogen and progesterone that's synthetic, that's handed to you from a pharmaceutical company. So that's very important. It raised the risk of stroke by 41%, increased the risk of heart attacks by 29%. Now, raised the risk of breast cancer by 26%. That's a huge one. We're going to really get into some things. I'm going to expose a little bit of what's going on behind this, because there's been a pattern since 1990 that hormone replacement therapy has been a huge issue with the development of breast cancer and the initiation of breast cancer. Twice the rate of blood clots, most likely blood clots due to strokes. So we're going to go through that, but that's where I'm coming from here. I don't think anybody, when they gave them hormone replacement therapy, handed up a consent form and said, hey, sign this consent form because I'm not sure what. They told you it would protect you from heart disease. They told you it protected your bones, and they told you that it would not cause cancer. Okay? So they told it right out. Now they're changing their story because a study came out, and they've been doing this to people for 60 years, and I still get people come into the office that say, I'm on Premarin, it's doing fine, my hot flashes are fine. Who cares about your hot flashes? There's plenty, that's what I'm here for, so that we can cover some other issues to help you with that, not just, well, I get you off that because of that. And they noticed that the risk outweighed the benefits. It was just so pathetic. So that's what we're going to talk about tonight. Now, I took this off of the American Cancer Society, and when you're dealing with cancer and you're talking about hormones, prostate cancer in men is breast cancer in women. It's that simple. Those two, it's not specifically detailed, but those two overlap each other a very lot. Then you also have the cervical cancer. You also have the ovarian cancer. You also have the endometrial cancer. So we're dealing here with breast, endometrial, ovarian, and cervical for just one thing: estrogen. That's pretty serious on all counts. It's going to be manifested in different ways because people are different, but it's pretty disturbing when you see one, 2, 3, 4 out of the top 2, 4, 6, 7. And I divided this up and I looked through the research and I said, now, how many for breast cancer is contributed to hormones that they think, according to research? This is not my opinion. They said that 67%, or 136,345, are contributory toward estrogen and breast cancer. That's a high 67%. Then I went in there and I said, okay, how much is genetic? Because some females have genetics. I looked it up and it said 10%. 10% have problems with that. Then I looked it up and I also said infection. Infection accounts for about 23% of that. So your viruses, your bacteria, all that stuff cause that. But that was overwhelming. They came up with 67%, or 136,345 people, is related to some type of hormones and breast cancer. Now, this was a study, real quick with a button. This is a study came out in Reuters that I copied. Estrogen, UV light, added to U.S. government list of carcinogens. Okay, they put estrogen. Finally, estrogen has been added to that real long list, and tamoxifen also, which is used for estrogen. Estrogen positive cancers was put also on that list probably about 6-7 years ago. So you can see there's quite a pattern here. But the estrogen, mainly with this issue, is we're going to see how it affects the cervix, the breast, the ovarian, and all that, and we'll go through that. Oops. Hang on here. We got a stuck button. Well done. Now, I took this study from the Journal of National Cancer Institute in 1990. It said, according to the 1990 study, the incidence of estrogen-dependent cancers, particularly among postmenopausal women, increased by 139% from the mid-1970s to the mid-1980s. In contrast to only 20% increase in non-estrogen-dependent cancers. There's where your 67% is on that chart at the top of the list. Now, just to go over a little bit, this depicts how the hormones are regulated in the system. Right here you have the uterine lining, and then up here you have the hypothalamus. Way up in your head you have a pituitary, and then depending on which is released at what time, it's depending on how much estrogen or progesterone is balanced. We'll go through that a little bit. But when you go through the first 5 days, that's the menstrual phase. That's shedding of the menstrual lining. Okay, that's your bleeding. Then what happens is you have estrogen that rises. It's a proliferative phase. So now this uterine lining starts to grow and proliferate. Then what happens is this estrogen raises the follicle-stimulating hormone, and follicle-stimulating hormone, when it gets higher, causes ovulation to release from the follicle the egg, and then now this follicle produces luteinizing hormone to raise your progesterone levels. Okay? And that's how it happens in a cycle. And then, as your progesterone raises, that supports and ripens the uterine lining while estrogen stays high. And then eventually, hopefully, if there is some type of pregnancy, the placenta for the baby will start producing, a high progesterone and allow that baby to be carried through term. And that's important to know because you can really break down the function of what's going on in a fertility problem if you know how this system works. So first, day 1 through day 5, and it's not 1 through 5 all the time. As we're going to see later on, there's some changes that are probably going to have to be in the textbook because everybody thought this was totally correct. There's some changes that are going on here. But usually day 7, if you have a period longer or you menstruate longer than 7 days, there's a problem. A good 5 to 7 day period, it should be a good time period for the uterine lining, for you to balance out. Then a 5 to 14 days, everybody's not going to be on a 28-day cycle. That's just the average. And then the first 5 to 14 days, that's when estrogen is the highest. And then after that, the secretory phase, that's when your progesterone starts rising. That's the highest. That's why it's highlighted here. And then you get the uterine lining, and then you get the implantation of the egg. And then that starts growing. That's very important to know. And just to highlight a little bit of, getting a little bit ahead of myself. But this is the menstrual cycle in a little bit easier depiction. And estrogen rising in the follicular stage or the follicle developing, and then the follicle is released and the egg gets released, and then you have ovulation, egg ovulation. Then you get your progesterone rising because that follicle produces luteinizing hormone, and then you get the progesterone raising, and your estrogen should be here. If your estrogen's up here, what is that? Birth control. Okay, so that they're playing with this cycle by manipulating your estrogen. That's what low dose estrogen is. Okay, and that's on a 28-day cycle. Now, this was kind of interesting because the thing that I left out that most of the time medical doctors have told you was that, estrogen helps with mental function. Helps with your brain, your bones, your heart, and your circulatory system, and your bone density. But this was an interesting study, and I picked this now not just because of the headlines, but as I read this, it sounded kind of funny. It said women who take hormones for years run a high risk of Alzheimer's or other types of dementia. Now, when you break down estrogen, there's different types of estrogen. There's mild estrogens and there's strong estrogens. Estrogen is just a molecule, and then you have variations off that estrogen. If it has that molecule, you can call it estrogen, but you can add on things, different branches that are chemistry to have different effects on different parts of the tissue in the body. But when you talk about estrogen, most likely in this situation, you're talking about hormone replacement therapy and birth control. Okay? This is nothing other than that. But when they say estrogen, the public doesn't know the difference, but there's probably about 31 to 33 different estrogens. So, and then I said, a startling study that turned upside down, and doctors have long believed about supplements. I'm like, why do they say supplements in this thing? Supplement. They should have said pharmaceuticals, shouldn't they have? When you think of supplements, you think of vitamins. So they tried to deter away from, I believe, alternative by throwing that in there. And you'll see it's another nail in the coffin for the use of hormones during and after menopause, says St. Louis gynecologist Robert Blaskowitz, a St. Louis University professor. The study appears in Wednesday's Journal of American Medical. Okay, it says the finding in 65-year-old women and older challenged the long-held notion that estrogen, progesterone supplements can help women keep their minds sharp. a belief that was based on small, less rigorous studies. Last summer, a government study was abruptly halted after finding an increased risk of breast cancer, heart attack, strokes in women who took one type of combined hormonal pill. That finding shattered the conventional thinking about health benefits of hormones and prompted millions of American women to stop taking supplements. Hang on a second here. This should be pharmaceuticals. They play with words. Some experts say that based on what is now known about supplements, women past menopause should not take hormones at all. Other experts say that women needing relief from night sweats and other menopausal symptoms should take the lowest possible dose for the shortest time. Okay? Let's see if I can get this right. Now, here's estrogen's function. Development of female secondary sex characteristics. This is what happens in the normal physiology of the body. It promotes cell growth and reduces bone loss. Now, it reduces bone loss because it stops osteoclasts from breaking down your bone. So it just delays it, okay? It doesn't produce new bone, but it just stops the old bone from being broken down, okay? There's a difference there. Increases body fat. That's the most common thing. Why do you think everybody in America is just a little bit overweight? And that estrogen not only creates a little bit of weight, it suppresses your thyroid, plays with your adrenal glands, causes you to hold more water than you should, causes different variations to make you gain weight, or plays with your thyroid so that you eat more carbohydrates and you have more insulin resistance and you gain weight. So there's different variations that happen. Estrogen's natural function in the body is also to create progesterone. It raises HDLs, which are your good your lipids, and then it stimulates and protects brain tissue. See, that's estrogen's normal function, but when you take it and you change the chemical structure of that, you lose all this. Protect brain tissue, I just told you, it was dementia. So they're using one thing and they're just adding it to that and saying it's the same thing. It's not the same thing. If it was the same thing, they wouldn't have come out with an article in the study. Now, progesterone's function in the body is to balance estrogen, reduce the overproduction of the uterine lining, and it ripens uterine lining for possible pregnancy. It protects and maintains the developing fetus during pregnancy to estrogen receptors. That's very important because if you were to take any type of hormone replacement therapy, whether it be progesterones or estrogen, while you're pregnant, you'll miscarry. You will miscarry. You can take a natural estrogen and a natural progesterone while you're pregnant and not miscarry. So we're talking about something your body can identify with from nature and something your body can't identify with. And I had a patient point this out to me because it's so funny. It was you. You pointed it out to me. She said, it's kind of funny. She says, you know, my doctor told me that if you don't have a period, your risk of cancer goes way, way up. And I said, yeah, so what? She said, well, why in the world are they trying to suppress everybody's ovaries with estrogen? It does the same exact thing. So you're stopping the cycle, but yet, in their terms, you're supposed to have your cycle. They're contradicting themselves. So when you really start breaking this down, it starts getting kind of scary. This progesterone here stimulates new bone. I read in Dr. David Williams' letter, which he did a great job on, it's called Alternatives. He did a great job on talking about how progesterone stimulates new bone. They did a study on a bunch of females, and they found that they gained 10% after 1 year and then 3% additionally after every year. You start losing your bone density, you females, by 21 years of age. So I was thinking, I need estrogen for my bones right away. No, you don't. That started at 21 years of age. That progressively got worse. So that's a multifactorial problem. That's just not an estrogen problem. but he did a good job of pointing out that natural progesterone, a good balanced calcium supplement, and a good good acid in the stomach would really do some amazing thing on your bones to raise your bones, whether it's osteopenia, which is before osteoporosis, or whatever it is, would really raise your bone density. Here's a fat burner. Of course, progesterone stimulates the thyroid. The thyroid stimulates your metabolism, increases your metabolism, raises heat in the body. You burn fat. That's why you feel that half-degree temperature rise when you're going through ovulation, because progesterone's being released. There's no reason why you can't keep a low dose or a low level progesterone up, through those last 2 weeks, because most of the time that's when the functional problem occurs, is those last 2 weeks when you need progesterone and it's way down here and estrogen's up here. You're still shedding the uterine lining, but what happens? God, I got fibroids, I got clots, I got cramping, my back hurts, I got an ovarian cyst now. So there's different ways to find out. It also acts as a natural diuretic. Just like calcium and magnesium. Calcium is antagonistic to magnesium, magnesium is antagonistic to calcium, but then they work together. Okay? Kind of like marriage. Estrogen and progesterone, they balance each other out, but yet they have their separate functions. And so a lot of times they don't like each other, but they're constantly competing. So, and then it acts as a diuretic in the body, and it relaxes the nervous system. So that's very important, because I know a lot of females that around their periods or going through PMS, they get that little irritation or that little anxiety, or they get that little rage that they carry, and they just want to do something about it. A lot of times they end up in the psychiatrist's office. But I'm here to tell you that particular situation happens deep in the brain. There's deep limbic system of the brain. That's the most primitive part of your brain where you have estrogen receptors. If progesterone will raise your estrogen just enough to offset that, so you don't have an estrogen dominance, yet you don't have too little estrogen. Because if you don't have that, you can't relax the nervous system, you'll be on edge, because that deep limbic system makes your sensory, eyes, tactile, and your smell additional, extra. That's where B vitamins work on that level. And you'll see how this interrelates. And then it acts as a natural muscle relaxer and increases sensitivity, supposed to be to estrogen receptors, and it's a precursor for other steroid hormones. All right, there. Now, xeno means anything that's foreign to your body. Okay? Xenohormones are foreign substances made by man that act to disrupt or mimic normal hormone functions in the body. The most common hormone disruptor is xenoestrogens, false estrogens or foreign estrogens that have an estrogen-like effect. Now, they've said that there's probably about 53,000 chemicals in our environment. And there's probably only about, I think the testing said there's only about 5,000 that have been tested for that were hormone disruptors, that acted as estrogen, that acted as thyroid, that acted as adrenal hormones. So there's, I need a calculator to figure out the math, but there's a lot more hormones you need, about 41,000 more that need to be tested. And I think this is a lot of times why we're having these problems. So that's a huge, huge number, but Congress passed the law where they're trying to test all these hormones. And they want to make you think that all this is all figured out. It's not. So there's some things that you need to be doing to protect yourself from these things, because these things are obvious things you can pick up very easily like a sponge from your environment. I don't know why this thing's sticking. That one right there. Okay, here's your xenoestrogens. These are all your foreign estrogens. The first one, obviously, is your synthetic estrogens and progesterones in oral contraceptive therapy and hormone replacement therapy. This is kind of important because I wanted to point out that in probably about 1989, when the economic community tried to, we tried to sell them some meat, import about $130 million of meat. they didn't take it. The reason they didn't take it was because they don't want the hormone implants from our meat. That was a big transition there, and that just sent out a signal to everybody that, and you see today, a male and a female, they're developing breasts at the same rate. Here's the petrochemicals, everything we like to put on our lawns and our vegetables and our fruits and all that stuff. So, be aware of that. I like the organic stuff, but, I don't believe everything they tell me. They say it's organic. I like to just check it out a little bit further because I like to know that what I'm talking about, I know what I'm talking about. If they say it's organic and it gets back around, it sounds like I don't know what it's talking about. So I kind of research it and find out if it's really organic or not. I just ask a couple questions. Solvents and adhesives, polishing glue, cleaning supplies, that's very important. What's that stuff? That's for your fingernails. Get your fingernails off, the polish off. Car exhaust that we're all exposed to, PCBs and dioxins. Good luck on that. The half-life on those, we're not going to get, most of them, we're not going to get any of that out of our system. That's the most detrimental to our system because when we start working out or we start pushing ourselves in a fitness program, those are the things that are turned over from our fatty tissue. Because these dioxin or chlorines or these PCBs, these things love fat tissue. What's the fattest tissue in a female? Breast. It's all fat tissue. So meats that are fed, estrogenic drugs, and plastics exposed to heat. Any saran wraps, anything like that. I just wanted to go over real quickly. I took this out of the a science magazine. It says that girls start puberty earlier than ever. Breast development in the 1960s for white females were 11 years of age. By 1996, it went to 9.96, and for black girls, it went down to 8.87. And then it said that the puberty right now, 9 was considered normal. Puberty now is 7 or 8. So that's a long time. It took to make a difference. And then there's a journal of the Puerto Rican Medical Association that 5-year-old girls are having breast acceleration and puberty and vaginal bleeding by 5 years of age. So, and you know what? You bring your kid into the medical, what does he say? Well, they blame it on your kid's endocrine system. Oh, it's your kid's developing endocrine system. No, it's not. We're killing ourselves. So, a lot of times you hear that. Now, problems with hormone replacement therapy. And I tried to pick these out so that when you pick other drugs and you find other drugs that people are on, there's a common denominator. These all apply. These apply to the same things. These apply to vaccinations up there. You put vaccinations up there, you can replace it with hormone replacement therapy. But wrong species. Well, you can't cross species, or there's there's viruses that certain animals have, there's viruses that humans have. You don't want to disrupt those patterns, or you end up with immune dysfunction. It's very dangerous to be mixing a Premarin hormone, which is horse hormone, with human hormone. It's dangerous. It doesn't belong. I don't care how you do the genetic structure. It wasn't designed to go into a female. Causes cancer due to DNA damage. That's obvious because of all the research I just put up on cancer and its growth and all that. Individual requirements difficult to adjust due to standard doses. Everybody's an individual. They only have standard doses on this. So if everybody is a little bit different, I think they should standardize the dose a little bit, but I don't think they're going to do that anytime soon. Metabolic rate changes. How quickly can you process this out of your system? Somebody that takes a medication, a pain medication, for instance, if they take codeine, I've had people come in and say they take codeine. I say, well, I don't want you on codeine, but finish the story. They say, well, I took codeine and I didn't metabolize it out of my body. It didn't feel like it did anything to me. Then they took a Vicodin. God, that just hit them off the center. Everybody's a little different in their metabolism and their detoxification. So when you start using this hormone replacement therapy, applying some of these pharmaceuticals, their metabolic rate is going to be affected. That is known to stay in your system for 8 weeks. Normal estrogens out of nature only stay in your system for 12 hours, 18 hours. So if your body doesn't want to use it, it gets rid of it. But if your body doesn't want to use it and you take the pharmaceutical, it's going to stay in your system. It's going to cause a clot. It's going to cause artery disease. It's going to cause cancer. There's various things. So metabolic rate is very important when you start getting into pharmaceuticals. And anybody tell you that pharmaceutical rep, they have a bell-shaped curve. Bell-shaped curve. Well, these people on the outside are in trouble. And even a little bit on the inside. So everybody's like, well, it ain't going to affect me. Well, when you start narrowing that curve down, you start adding up those side effects and how that affects everybody's body, you're going to only be able to give that to maybe 30% of the population without somebody having an effect when you start adding all this up. So don't get fooled by the statistics. Here's excess factor. You know, a lot of females, because if there's a lot of estrogen in our environment and we're taking hormone replacement therapy, I think the most difficult reason that we're up against this in Western society right now is because our diet has over 176% more estradiol than any other country. Japan, China, all those countries, they got more. We have more estradiol in our diet, in our system, in the environment than any other country. That's why, God, all of a sudden you go through menopause and this thing just drops. Your body's not used to that. You kept it up there all the time. You oversensitized yourself. Then all of a sudden it's going to drop a little bit when you go through menopause. Obviously your body's going to be screaming. Estrogen's a drug. You're having a rebound effect and having a hot flash because you don't got enough of it. Because your levels were too high due to your diet, due to your liver not processing estrogen correctly, due to too much fatty tissue turning over and making too much estrogen. I mean, there's a lot of variables involved. Increases sex hormone binding globulin. You don't want to do that. That's disrupting your thyroid. That's what stops your thyroid from working. And then obviously you got to the side effects. Here's your side effects here. Heavy menstrual bleeding, fluid retention, edema, weight gain, increased fat storage, migraines, headaches, anxiety, depression. So when somebody's on 3 or 4 medications, and they come in, they're on Prempro and they're on Prozac and, they're on Synthroid for the thyroid, all these go together. There's all one common denominator for all these problems. Glucose intolerance, estrogen dominance, facial and body here. You shouldn't look like the bearded lady. I saw that bearded lady on Court TV, I think. She was on it. I'm like, God, she had a full beard and she ran with the circus. And I'm like, I couldn't believe this when I was in high school. I was watching this. I think it was the People's Court or something. Stimulates fibroid growth. It's going to stimulate breast growth. Breast tissue growth is going to stimulate more uterine lining, more fibroid growth. Breast tenderness, nausea, vomiting, cramping, bloating, legs cramp, and eye problems. There's a lot of people that are having that fog. There's some other issues, but that fog could be due to hormone replacement therapy, or it could be due to that glucose intolerance over here causing the fog, because that's a major issue today, is type 2 diabetes. And that's on a rise. High blood pressure, and then increases blood clots, and then gallbladder disease. Oh my goodness. Now, this is kind of like the strange advice that I hear when it comes in the office that I kind of share. High-risk women should cut off their breasts to avoid breast cancer. Now, has anybody heard that? Because I sound like a fool saying it. I don't know how a medical doctor can say it straight. But, It's low dose. It can't hurt anything. This is what they're coming up with right now. They're saying, well, we got a low dose estrogen now that we want you to be on. It's very low dose. It doesn't matter. It makes it a higher dose just due to our environment. So you got to be doing something in the meantime instead of buying that. The hysterectomy scare is huge. They always scare you about that. The doctor wants to take out my uterus because it's got fibroids, you know. And there's an alternative that I have at the end here that I think will be helpful. And it's kind of new, and I've been using it, but it's researched, and it beats getting your parts taken out. I don't want any of my parts taken off or out. Hysterectomy scare, and then follow-up tests will let us know. The biggest con I've seen is mammograms. Mammograms, when you're at 40 years of age and you go in, that's when your breast tissue is the thickest, is the fullest. So there's no way you're going to be able to see something that might be possibly identified at a different age. The problem with that is there are more false positive. What is a false positive? False positive is when, they tell you that you have cancer and you don't. A false negative is when they tell you don't have cancer and you do. So it's very scary, but right now, I was reading an article, and it kind of said right now the rate of them picking up breast cancer in your breast is your life expectancy is no better. Even if you got breast cancer, it's no better. Plus, I read that it's about 45%, and it has to be at a certain developmental period. And a lot of times they can't see it because it's too small a lot of times. Plus, you compress the breast. There's issues with that and breaking. And if there is something detrimental, that could spread and cause more vascular supply to that area and make something really grow. Or they can do an MRI that's 95% accurate. An MRI is 95% accurate, and none of the hospitals and none of them are doing this right now because it takes a long time to train all these people and get all these people to know how to read an MRI and look at it, but they looked at it, and 95% of the time they were right on their decision. So if any of you female have any questions, we like to use thermoscan in the office to see different things that might be developing. Fibrocystic breast, there's different issues, but if this was on the line and I was suspicious about something, MRI is where I'd be looking at, not another mammogram. The mammogram is about the same as a breast exam. That's the same percentage. So follow-up tests will let us know. Well, a lot of times a follow-up test for especially cervical cancer or cervical dysplasia or whatever the heck they want to call it, what's feeding the cervical dysplasia or that human papillomavirus? Estrogen. So your tendency to come back with a phase 1 or a phase 2 level for cervical dysplasia is very high if you're on a birth control pill or you're on hormone replacement therapy. This is a little bit on the thyroid, not to get ahead of me, 3 weeks ahead, but inactive thyroid, T4 to T3. This is the conversion factor. This is what happens in your thyroid gland. And in order to use this enzyme, you need zinc, selenium, copper, and glutathione. This T3 right here becomes inactive when you have high cortisol, high estrogen, and high testosterone. So I think a lot of what's happening right now, I've seen it in some cases with polycystic ovary and high testosterone levels or high cortisol levels because their insulin levels are high. That's a possibility they have thyroid dysfunction. But there's things you can do about that, but the main thing is don't let estrogen disrupt your thyroid. That will slow your metabolism and make you, overweight, make you tired, make your hair fall out, all that stuff. Okay? Now there's back to this. Another strange thing I see right now. People are coming in. Well, they put me on a low dose of Prozac, which is now Serafem, which is the same. But they're coming in and saying, well, for hot flashes and anxiety, you could take care of it with a psychiatric medication. Why would you want to take a normal female for a psychiatric medication and put them on a psychiatric medication when they have no depression? So, I mean, this is what I'm supposed to be doing up here. It's common sense. So if you don't have depression, and I don't recommend any psychiatric medications unless it's absolutely necessary, but the main point being they're trying to divide the waters a little bit, and they're trying to get a little money off this hormone thing. They're trying to promote other things, low dose, anti-psychiatric medicine. They're trying to do that to make up for the loss they're having on hormone replacement therapy. Because I don't know of any doctor that would approve of that when you don't have depression and they're putting you on an antidepressive medication for a hot flash. I thought this was supposed to be scientific stuff. It's not. And this. Now, this is a sticky button. Okay. Now, the word estrogen has created a bad name because of its ability to promote the growth of some types of cancers, but most phytoestrogens are not estrogenic. It's unfortunate these very beneficial compounds have been stuck with this name. So when everybody thinks of estrogen, I always get I said, I'm going to give you a little bit of estrogen. What? I thought estrogen was bad. That's what automatically they say. Well, there's different types of estrogen. There's about 4,000 different estrogens in nature. So we're going to go over that. So there's different estrogens you can use to allow, you're throwing that in there. If your body wants to use it or shift it or use it, it can. Your body's a processing factor. It makes pain hormones, it makes endorphins, it makes dopamines, it makes estrogens. It makes all these things. It's whether, it's not enough to create a specific effect on the body, but there's an estrogen. I'm sure if that molecule is put in the body knows how to process that. If you're adding that to your food or you're using that through a supplement to raise that level, there's nothing wrong with that. Your body's, if there is, your body knows how to get it out of the system real quick. Now, 3 most common estrogens. Estrone, 5 to 10%, is considered a strong estrogen due to cell growth. And then estradiol, that's the one that I always see that females bring in. I'm like, you don't want to be on that one. It's considered the strongest estrogen due to cell growth. You're stopping the female cycle. That's the most common one to run your cycle. Follicle-stimulating hormone, luteinizing hormone, estrogen, progesterone, shed the uterine lining, menstruate, keep on going. Well, that's the one that is most used to shut off hot flashes and help things. But that's the one that is the strongest estrogen. Now, there is a God out there that did design something that you would think as you're aging and developing, you don't want to be stimulating things. Okay? Because if something wants to grow, it's going to grow. That's the best way for it to grow. Yeah, I hit the source button. I got it. So that's the most crucial one that needs to be dropped for your ovaries to stop making, because that's the one that grows the most and can cause vaginal, uterine, breast tissue to grow, all that. Estradiol is 80-90%. That's the safest one you get. That confers protection for those other two, estrone and estradiol. So that's the one that protects you. That's the one that's mostly found in nature. This button. Oh. Yeah, because it's skipping. It just keeps on sticking. Right there, yeah. Thank you. Now, phytoestrogens are a diverse group of plant-derived substances which have estrogenic activity. The structures of these compounds are similar to estrogens, but their actions are less powerful, about 1/1000 as potent. Consequently, when estrogen levels are high, phytoestrogens compete for estrogen receptors, reducing the effects of excess estrogen. Okay? So it's actually protecting the receptor. You can push it one more. So the excess estrogen in this case are safely metabolized or broke down by the liver. When estrogen levels are too low, as in peri or postmenopause, phytoestrogens act as an estrogen supplement. Thus, phytoestrogens balance both excess and insufficient estrogen by acting as an anti-estrogen as well as a weak estrogen. So it's very protective. Very nice. These are the most common phytoestrogens that are studied. Isoflavins, which have to do definitely with the soy. Soy is the most studied isoflavin. That a lot of people use that for hot flashes. That's in one of the products I use for females, and along with other ones. They found, I ran across a study, but I was searching, and I was like, where is this article? I was trying to find this article, but I ran across, the more phytoestrogens you use together, the better the effect you get throughout the body. Okay, so there's like a synergistic effect the more food you use. So in one of the products I use, it's licorice, Babasco, it's got a little bit of soy in it, it's got a little clove. It's a whole combination of things so that your body can pick and choose what it wants. Then the ligands, these are mostly your flax and your berries. That has been known to reduce tumors by 50% in breast cancer. That has been known to down-regulate high estrogen levels in the body that are detrimental. And then you have the coumarin esterol, which are your clovers, your leaves, your forages. There's different types. Now, isoflavins, ligands, and coumarestins are known as phenolic estrogens. Phenolics are members of the largest single family of plant substances known as flavonoids. Over 4,000 different flavonoids have been identified. Of all the phenolic phytoestrogens, the isoflavins are the most widely studied. Next. It has been shown repeatedly in scientific studies that people with the highest level of phytoestrogens in their blood have the lowest risk of cancer. Now, most of these phytoestrogens come from apples, onions, leeks, licorice, soybeans, alfalfa. I mean, they're all scattered all over nature. Next. Now, the benefits of phytoestrogens is to prevent proliferation of estrogen-driven cancer cells, like it's to downregulate receptors, increases the bone marrow density or body mass density, it lowers cholesterol and triglycerides, it increases HDLs, and it inhibits the growth of cancer cells, both estrogen positive and negative. That's pretty important. And then it controls aromatase enzyme. That's important in men because that's the hormone that changes to men, raises their testosterone. If that aromatase enzyme is having a problem, it will change testosterone into estrogen. And then men will have these bellies and have all types of prostate problems. And then it also interferes with vasoendothelial growth factor, which allows cancer to spread. Now, this is an important issue because this is more of an indirect effect that I noticed from certain females that come in. They say, well, I have, they have high estrogen levels, but yet, their prolactin levels are off the charts. Or they come in and say, I got a bad headache, and it's right around my PMS time. It's, it only happens at a certain time during my period. This is most likely what's causing the headache. Your body, when it goes through changes, everybody recognizes prolactin, 4-lactose, lactin, milk letdown. So what happens is estrogen raises high and stimulates prolactin levels in the brain. If prolactin gets too high and your body can't regulate it, the pituitary swells and you end up with a headache. Your brain swells. God, I got a headache because it's pounding. Well, estrogen does that. There it is right there. Estrogen. Opiate narcotics do that. All these things. Anti-seizure medications, Respirin, serotonin reuptake inhibitors. What are those? Prozac, Paxil. All those things can raise prolactin levels. And these are the things that actually can turn pathological eventually over time. And the one is primary hypothyroidism, and that's where estrogen stimulates prolactin. Now, when prolactin gets stimulated in your cycle, that a lot of times causes breast tenderness or mastalgia. So in females that have this problem or on some of those medications or doing that, a lot of times I'll recommend the Chase tree because Chase tree lowers your prolactin levels. If you take too much, it can raise it. If you take a little bit, you can lower prolactin. So around that time in your period, the last 2 weeks of your period is probably the most beneficial if this is being affected on your system and causing migraines or swelling or breast tenderness. Next page. Now, here's your indicators by testing. A lot of times I do the muscle testing in the office, combined with history, the symptom survey. There's a urine test that you can use that you want, higher ratios of the 2 than the 16. There's a blood and saliva testing. The biggest thing that turned me on to this is seeing that high C-reactive protein test. C-reactive protein is a protein marker for inflammation in the arteries, okay, or inflammation in the blood. And I was reading about that, and I noticed that after females were on Premarin or any type of hormone replacement therapy or anything, their levels raised 84 to 85% higher than normal after 6 to 12 months. So that doesn't help your arteries any. And that study was repeated probably about twice. There was 2 studies that mentioned that 6 to 12 months raised your C-reactive proteins. And that C-reactive protein could be raised because you're overweight, because you're on estrogen, because your insulin levels are too high and you're a diabetic, or because you have some clotting going on in your arteries. And we have the fibrinogen levels to tell whether there's fibrin building up in the body. That's very independent for estrogen because estrogen raises your fibrinogen levels. So if you're handling too much in your body, that fibrinogen level will be high. Lipoprotein A, natural estrogen will actually lower lipoprotein A, and that's just a fat in the artery that actually goes, and if there's too much, it will bind to the inside of your arteries and start plaquing up. And then, obviously, TSH, free T4, and then the free T3. And I put this blood and saliva testing, I put that saliva testing up there because a lot of times I explain to females, I say if we're having I have a pretty good success rate with the female issues. I do very well with it. All the females are very nice to me. I never had any problem with it, about 1 or 2 females. But everybody's been pretty nice. And it's been enjoyable doing this. I never would have thought I would do female issues, but it's been an experience, and I'm happy I've been doing it. But there's some people that are very difficult cases. They've been on progesterone creams. They've been on various different things. They've been on various different supplements. And when I go to do a salivary test on them because they've been so difficult and everything's been sporadic and it might not even be the problem, I can't get a good test when you've been on cream. That's the toughest part. Nicotine, been on the creams. The creams are progesterone cream. So a lot of females like to be on the progesterone creams, and you build up that progesterone level through your fat, and then it spills over, and your body can use it. That's how that happens. And it takes at least a month to build up in your system. That's why I don't like using that. I don't think there's anything wrong with using that, but when I need to be specific and I need to find out what's going on, I use what's called Progon B. That's a sublingual. I don't want anything being digested. I want you at least, if I know I need 100 milligrams or I need 50 milligrams, I'm going to know that you're even though if you don't have, nobody has good digestion in America. But progesterone creams and your digestion, there's an issue there. On the Progon B, I can get that certain amount within that range very quickly using the sublingual that goes right into your system. And there's some positive benefits and, to progesterone cream. There's some positive benefits to sublingual, but I found through the testing, I can keep a more accurate reading when you do a saliva testing because it's not going to raise it or cause it to be excessively high when you be on creams for long periods of time. So that's why I choose to use the sublingual. And plus, a lot of digestive problems, you can't digest it. So the best blood supply to the rest of your body is through your mucosal membrane, right through your mouth. So that's why I use the sublingual, and it's applied under your tongue once in the morning, once at night, and it depends on your circumstance and how you use it. Here's a little bit of a cancer scare for the pill. Women who use the pill may be twice as susceptible to cervical cancer, according to the new research. A study by the World Health Organization suggests that taking the pill for between 5 and 9 years raises the risk by 65%. And usage for 10 years more than doubles the risk. Now, there's some people that, that want to take the pill and they want to be on the pill, and there's some protective factors you can do. A lot of females are on the pill to balance out their menstrual cycle, which you shouldn't be on the pill for balancing out your menstrual cycle. You ain't balancing anything out, you're just shutting down the system. So, there are things that you can do as supportive for the pill, if you are on the pill, to protect yourself from clotting and heart disease and bone and all that. That's not going to interfere with anything or negate the effects of getting pregnant. Next one. Now, Depo-Provera. This is a big one. This is the one that they inject once and it lasts for 3 or 4 months. And it's a long-lasting contraceptive. It doubles the risk of breast cancer among women who have taken it for less than 5 years, and it seems to be at its most dangerous in the first few years of use. This startling discovery was made soon after Hormone was finally approved for marketing in the United States. Many countries have held back from granting a license because of the breast cancer risks associated with a progesterone contraceptive. Sudden change of heart by the American Food and Drug Administration was caused by 2 studies from New Zealand and by the World Health Organization. Like the FDA depends on anything from New Zealand or the Danish or anything like that, which both concluded that oral contraceptive did not heighten the cancer risk. We know it does. Progestins does. We already know. I got enough studies to to at least 10 pages high. Next one. Let's get there. However, a closer analysis of the data shows that the risk in fact doubles in the first 5 years of taking the hormone and then drops to almost nothing after that. Researchers believe that Depo-Provera might quicken tumor promotion and growth. If it does, its potency must be far stronger than doctors believe because just one injection seems to be able to influence cancer growth for the next 5 years. And that's in the Journal of American Medical Association, 1995. Now, what's the biggest side effect of Depo? Does anybody know? The biggest side effect of Depo is weight gain. Weight gain, headaches, irregular periods, and 30 to 40% of those that took the Depo shot had no menstrual bleeding at all for their period. That's it. It was shut down. That's it. And then going back to what a patient picked up on was, if you don't have your period, your risk of uterine cancer and ovarian cancer goes higher. There's also fatigue, abdominal pain, and decreased sexual desire. That sounds wonderful for a contraceptive. So I think there's other ways of doing it. Okay, next page. Now, this is the loop. I was reading all this. I'm like, wow, I think I got all this figured out. Well, it happens more often than you think. Ovulation. Sometimes an obscure medical journal comes up with a discovery that makes you rethink something that we all thought we knew. Take, for instance, a recent piece in Fertility and Sterility. Now, how often does a woman ovulate? Once every 28 days or so? Wrong. How about 3 times a month? Canadian researchers monitored 63 women, all of who had at least 2 ovulations a month based on follicle activity in the ovaries. This would explain why the rhythm method is unreliable and why some women on the pill still become pregnant. If this is confirmed, we'll have to rewrite the textbooks, said one researcher, and then you can say that again. All right, next. Now, this is one of the benefits, besides using estritriol to help with hot flashes and keeping the thyroid going, not disrupting the thyroid, not causing gallbladder problems. This is estritriol, which is the safe estrogen. Estritriol given at 0.5 milligrams twice weekly after a loading dose of 14 days have been shown to reduce recurrent urinary tract infections. Well, it just so happens that estrogen stimulates the proliferation of the good bacteria in the vaginal epithelium and also reduces pH and avoids the colonization of a bad bacteria. This is the main pathogen of urinary tract. So it's very important. So knowing that and knowing if you have any recurrent infections vaginally or urinary or kidney or anything like that, estritriol might be an addition you might want to add as a possibility to support this problem. And this came from the Infectious Disease Clinical Practice, 1999. Now, here's the premenstrual syndrome, chaste tree and Vitex agnus cactus. This happened in about 1,600 patients, and these histories were obtained from 857 gynecologists in Germany, and contained, that's how much of the dried leaf extract, you don't have to really worry about that, but subjects took a dose of 1 capsule twice daily. Results showed after 3 menstrual cycles that 93% of the patients reported a reduction in the number of symptoms or even in the cessation of PMS complaints. That's a high level. 85% of the physicians rated this therapy as good or very good, and 81% of the patients noted that after treatment that they were much better or very much better. Complaints of mastodynia was less severe, and that's what I talked about, that suppresses prolactin and estrogen and indirectly affects progesterone in the body. So 94% of the patients noted the tolerance of Vitex to be good or very good. Adverse side effects were noted by physicians in 1.2% of patients, but there were no serious drug reactions. So they might have a little stomach discomfort or something, but 1.2%. Next one. Now, this study was done by Carrie Bowen. I took this out of Nutrition and Healing from a newsletter, and this is Jonathan Wright's newsletter, and it mentioned on a Japanese medicine that scientists have known to shrink uterine myomas or fibroids. This was found out in 1992. It's called KBG, not KGB. And they also use another one. The different substances in there are cinnamon, peony lactiflora, pruninus. I can't pronounce all these, but those are what made the biggest change. This formula is frequently used in gynecological disorders such as pelvic inflammatory disease, menopausal symptoms, and menorrhagia, excess bleeding, or dysfunction of menorrhagia related to too much congestion in the uterus, that's cramping of the pelvic region. In an open study out of 110 premenopausal women, this is what came out. Number of cases, normalized 29, improved 31, there were 3 unchanged. Dysmenorrhea, 51, 26 normalized, 22 improved, 3 unchanged. Anemia, 14, 6 normalized, 8 improved, and then I guess everybody improved. Then here's your uterine myomas or fibroids, 31 or 21 normalized, 47 improved, 37 were unchanged. Well, I decided to take this and add things that I found in the research, and the research also says that taking probably about 500 milligrams of primrose oil 3 twice a day would reduce fibroids, and also adding what's called liquid iodine or potassium iodate that helps break down fibroids also. So doing those 3 in combination would definitely raise all these factors and give a higher success rate. Okay? So I kind of put that program together myself with just this information. Jonathan Wright did a very excellent article on nutrition and healing, his newsletter, and he talked all about liquid iodine and potassium iodate. And if you come into the office, you probably already got it if you're on it. But it's a great article, and if you're a patient or you're a new patient in the office, that information is made available to you. Next one. Here's another interesting thing on dysmenorrhea and thiamine. In double-blind study of 556 girls between the ages of 12 and 21, subjects had moderate to severe spasmodic dysmenorrhea. They had spasms and clotting. They found that just vitamin B at 100 milligrams orally for 90 days showed an 87% cure. Okay, so that's important. And that goes back to what I talked about in the deep limbic system, because sometimes when your hormones change so much, that can change your metabolism. Bees are known to relax the deep limbic system right in the brain. So if you have excessive hearing or excessive smell, or you wake up and you're just freaked out, or you're scared in the middle of the night, you think you're hearing noises, that's that deep limbic system that's overrunning. And the bees will calm that down, as well as help with PMS, as well as help with your sugar metabolism, as well as make you happy. So it's just not one thing that this stuff does, it's a lot of different things. And that was done in 1996. This is our daily supplemental protocol that we use in the office. These are all-around dailies for adults. 6 catalins, a multivitamin, multi-mineral. It's got about 15 different foods in there. We like to stick to foods and not pharmaceutical vitamins. There's 2 multi-mins. There's 1 teaspoon of PDCM, which stands for plant-derived colloidal minerals. This is supposed to allow you to at least get all 91 of your nutrients and be able to, serve so that your body can pick and choose what it wants. So we try to get the best well-rounded thing. So if anybody comes in the office and say, I want to be on the basics, that's going to be your basics. Now, the estrogen thing that I talked about that was critical is that Vitanox. That Vitanox will stop estrogen from grabbing onto breast tissue, from proliferation, from petrochemicals, from plastics. That Vitanox will do that. That's very important. I had one lady come in. One lady complain about this Vitanox, which is a good complaint, because I learned something about it. Sometimes with that Vitanox, maybe you can mop up too much estrogen out of the body and turn off too much estrogen, so that now you have a hot flash because you took a Vitanox. That's a possibility. So I said, well, that's a rare situation, but I'm going to take you off that Vitanox. I'm going to put you on indole 3-carbinol, so if there is a bad estrogen, we'll convert it to good estrogen. And we'll keep your estrogen levels at where they're at so you don't have your hot flash. Because she started taking that and getting hot flashes. So there's different ways to work with it. Everybody's a little bit different. That was the first time I heard of that. But hey, that was good that she told me that. But that was good that I learned that, because that's mopping up as much estrogen as you can soak up from your environment, or you can have too much because your liver ain't processing it out of your system. Okay? And then here's the kids' regimen. And I also want to mention that Catalin for kids. I also like that Jungle King. Jungle King is very well tolerable. I can get my kid to take as many vitamins as he wants on that Jungle King. The more I feed him, it tastes so good. It's probably your closest you're going to get to Flintstones without artificial. But, I have heard some, I can't get the Catalan down. It doesn't taste right. It doesn't come down my throat right. The kids, all that stuff. But the Jungle King worked very well. And they chew it up. It tastes good. And then you want to make sure they're getting plenty of essential fats. And I didn't go into too much fats, but fats are a big issue. One thing I didn't mention would be the Osteoderm V. This is a great cream that you use intravaginally. There's some females for sexual problems, vaginal dryness. They're having some thinning of the urethra and they're leaking urine because they're losing their estrogen, because estrogen holds water. This product here is not only estrogen but also progesterone. But as far as vaginal dryness, this ain't going to reach the vaginal tract. So they made something more specific because the vaginal tract is considered the outside of the body. Yeah, there is some exchange, but to be most efficient, that's what you use as far as lubrication to re-establish a hydration in that vaginal epithelial or that vaginal tissue. Okay? And that's how that works. And then the next slide. Anything I talked about, if you have any questions or anything like that, you can come up front. Or we have a fax made available at the office that you could fax in order. Somebody that needs something, or you want to try something or do something. I always recommend get it tested first. Always test it first. But the first thing I always recommend, if there's really no guidance and you haven't gotten in the office yet and you want somebody to help you, the first thing I would do is go with the basics. The basics, you can never go wrong with the basics. Okay? Those are your Catalan, your Flax, your PDCM, and your Vitanox and your chlorophyll. So that's the number at the office. Is anybody, it's made available to anybody in any state. We're always faxing things out to people, and we're always getting these things coming in. All right, now I want to test some people now. What do we do with those sheets? You have those sheets? What's that?
The extra ones.
Yeah. That's only one. How many is that in there?
Yep.
Now, Dory Crump. And another thing I wanted to mention, if I haven't covered anything and you're a patient in the office, there's videos that Dr. Ten has made. There's videos on brain attack. There's videos on using herbal remedies. There's videos on detoxification and weight loss. Some of this overlaps with what I talked about up here, but they are separate issues and they should be looked at separately because there's too much information, to swallow. But all those videos are made available at the office. If anybody, needs access, just go in there and ask, and anybody can rent them out. Let me see. Is it Dory Crump?
Yeah.
Come on up here, Dory. Let's check. Now, Dory's thyroid problems, had a hysterectomy.
Also had a lump removed from my breast after being put on hormones.
Okay. So you're a good one to pick. Come on over here. Now, first thing I want to check is how electrical she is. Put that in your hand. Hold tight. Now, what are you taking right now for hormone replacement therapy?
Nothing. I went off the patch 6 months ago.
Hold tight. Why did you go off the patch?
I had heard it caused cancer, and I had already had enough with surgeries and.
Okay. Always be weak with a cigarette. There's about 3,000 chemicals in there. You know how long that took to come out in the media and the press? For the cigarette companies to, get in trouble for all this stuff? Yet the Surgeon General's had that thing on there forever. Hold tight. Now, the main thing with her, you can look at her and I can feel her hair. When I feel her hair, it's kind of brillowish. It's not soft. It's not. I don't mean to get on you.
It's okay. It's because I'm on
But-
thyroid meds.
she's on thyroid meds for that, but you definitely can support with a good essential fatty acid to make that hair smoother, a little bit better on that. But I don't think, nutritionally, I don't think they're covering that. Turn this way a little bit so we can get you on there. Go right side, left side, staff, strep. Are you pretty swollen? Do you still have two overs?
No, I have nothing.
You have
I've
nothing?
taken everything.
All right. Still have your gallbladder?
Yes.
Okay, good. I haven't taken everything.
I've taken everything.
Now, put your arms out like that. Hold tight. Now, there's something else she hasn't told me. How sore, how stiff she is, how bad your joints feel.
Awful.
Ovex P and the calcium. Now, one thing that's going to happen is when you take the ovaries out, the calcium assimilation is probably the most functional through the ovaries. So if you have no ovaries, you got to try to trick the body into thinking that it has ovaries so you can absorb more calcium through the gut. Okay? Because what's going to happen is she's going to end up bending over like this, or she's going to end up with a severe pain, or she's going to end up with a fracture and she's going to break her hip before she reaches the ground. So those things, she's got to get some calcium support, because the first thing that she's lacking is absorption of calcium. So just being on hormone therapy is not going to absorb her calcium. It's going to do other things, but we can trick your body into thinking. So let me check one other thing on you. And that's a major thing. That will relax your nervous system. That will keep you off edge. I mean, calcium is a major thing. Now, there's kind of a routine I use. There's an Ovex. There's Ovex, and there's Ovex by bovine, and there's Ovex by porcine. Some people can't handle the pig for whatever reasons, so you can use the Ovex also in this case. But this is the one I use because the porcine acts a little bit more, pig is more like a human. That's why they use pig hearts, pig valves, all that. But I'm going to use that to help absorb her calcium levels. Good. When did you have your hysterectomy?
3 years ago.
Hold tight. Good. 2, 4, she's a 6 on an Ovex P. I'd probably have her on 6 Ovex P. I'd probably have her doing that probably for a month. Now hold that and we'll see. When you're on that, how much calcium you need that your body wants with that, because it already knows what it's going to do with it. 1. Turn this way, so good. 2. Good. I can't believe I forgot I forgot that chart that everybody's looking at me like, what the heck is this guy doing? There's a chart that goes over there. If you can picture it, it's over there, and it has hands out like this, and that's for calcium metabolism. If it goes down, according to Dr. Versendal's research, she's been doing this for probably 45, 50 years. If your arms go down and you're resistant like this, in that particular position, you're low in calcium. That's what I used on her. So just to update. I totally forgot about that. So this is how much calcium she's going to absorb with that in her hand. Now, take this away. 2, 4, 6, 7. Now, there's a little trick here. I got a 7 and a 6 on the Ovex. 6 on the Ovex, 7 on the calcium. Now, I'm going to ask her body, if I don't give her that Ovex, how much calcium she needs to balance her system out without the Ovex. Good. Now she becomes weak. Take that back, put that in my hand. 2, 4, 6, 8, 10, 11. Now, that Ovex P brought her from an 11 to a 6. That's how much more she'll be absorbing her calcium, and she won't waste it doing the Ovex P. That's how that works. So she needs to be on 3 calcium twice a day, 3 in the morning, 3 at night, with 3 Ovex P for 1 month, and then we could probably keep up the calcium and go down to 2 and 2 on that OVXP. And that should help with your bones. That will really make your bones sturdy. That'll help with your joints. Now, let's check one more thing, because she was perfect patient. This. Good. Now, her thyroid. I'd love to do something with her thyroid.
I'd love to get off my medication.
What medication are you on?
I'm on Levoxel, 75 milligrams.
All right. Positive, negative. Let me see that. Do we have Thyristim in there?
I think we do.
I like Thyristim because a lot of times you can tell where females need help just by their morphology, how they look. Now the hair thing, if we don't get her calcium taken care of, and we don't get her thyroid balanced, her calcium, her thyroid balances her calcium levels in her body, calcium and phosphorus levels. So we don't get her thyroid level. I bet you we got her thyroid humming good. We might even be able to lower that even lower with that calcium.
Well, they supposedly killed off my thyroid.
You drank the stuff?
No.
Radioactive iodine?
Oh, yeah, I done that too, but...
Was that in like a metal jar or something?
God, yes. They brought up in little gloves and the whole bit.
There's got to be an alternative.
And they told me I had to flush the toilet 5 times after.
You had to flush the toilet 5
because
times?
Of the stuff that blow off. I don't know.
2. Let me see those cataplex. Are you allergic to iodine?
No.
Cataplex F tablets. Yeah. That's scary. I don't mess with that stuff. You drink this.
I wouldn't want to mess with it either.
I know. Nothing on you, but you know, when I listen to Oprah and Dr. Phil, I like Dr. Phil. He's got a lot of good information. I listen to Oprah and all this stuff and hormone replacement therapy, and they keep on saying the exact same thing. You know, don't drink coffee, teas, colas, or chocolates. Does everybody know that? No coffee, teas, colas, or chocolates. And I hear the same thing over and over again. I'm like, I need some new information here. Nothing's helping. I've had so many females have their hot flashes shut off just doing that Phyto B. I have so many females. And if they have breast cancer, I use the Progon B, a more conservative approach. And then, if I want to be a little bit more aggressive, and then follow their lab tests, I'll have better success. So, what? Really?
Mm-hmm.
I don't know why. 2, 4, 6, 8. And this is her essential fats, and I'm going to get her thyroid going. I'm going to use some essential fatty acids and some iodine. That pill's made for fibrocystic breast, thyroid, and to get her fats to soften her hair. That's what we're going to do on her. I want her on 3 twice a day on the Cataplex F tablets. And we're going to do that. I'm going to have her doing that for probably a while. The only thing I want to watch on you with that iodine is you don't race a little bit. So don't take that 3 in the morning, 3 around afternoon, nothing after 6, because you'll be irritable. You're like, how come I can't get to sleep? Because the iodine's pushing you a little bit too much. Okay? So
Should I stop taking my thyroid medicine?
no, do not stop taking any medications. I would rather have you on this and then have you go check, retested.
Okay.
Okay? But that's the 3 should be on: calcium absorption, essential fatty acids, and a little bit of ovarian support for estrogen and progesterone, as well as, because that's got a little estrogen and progesterone in it too. Okay?
Great.
Thank you for being good.
Thank you.
Yep. Yeah, it's fine. Okay. Okay, Mary Myler. All right, let's test you out. Now, let's have Mary, let's back this. I don't think we're going to need the table today. Turn this way. Let's test you. Hold tight. Now, what's your biggest problem?
Thyroid, too many medications.
Too many medications? What medications are you on?
Lipitor, Toprol, Tricor. I've got a whole list of them.
Now, you're kind of in a dangerous situation. When you start
I
breaking...
don't believe in this, in cigarettes.
Oh, yeah.
Sorry about that.
Well, whether you believe in it or
I'm
not, they're going to
teasing.
make you weak.
Oh, okay.
So you're right about your beliefs. So she's a good tester. She's got plenty of energy. Put your arm out. Hold tight. So now Lipitor. Let's think this through. Lipitor, Zocor, Lipitor. Which one? Lipitor for your cholesterol.
Tricor,
Tricor for your triglycerides.
Toprol.
Toprol for a beta blocker.
Go in my purse. Here. I take this up. It's too much for me to remember. There you go.
Nitro Quick, okay. Levoxel, Lipitor, Toprol, Tricor, Nabutone, folic acid. Oh, they got one. Folic acid, that's not a drug.
No.
Protonics, because they're trying to change the tone of her esophagus there, because she's got some GERD.
Right?
And GERD, what is GERD? Vomiting. You're vomiting your food back up. And Ecotrin and Kirkland Daily with lutein. It's got the lutein in it. Okay. All right. I picked a tough one to end this, but we'll go through this. Nitro Quick, Levoxel, Lipitor. Now, if they got your thyroid working correctly, you should be able to metabolize your fats out of your blood, because thyroid controls your metabolism. If your thyroid's not working correctly, that will slow down your blood fats and how they're burned. So you'll have more fat hanging around if it's a slower thyroid in your arteries. So if we can get her thyroid balanced, we might be able to take care of this Lipitor, because Lipitor is going to make her very tired at her age. It's going to make you very fatigued.
I'm 72.
She's 72. And she's on Toprol. Now, your blood pressure was high?
The last time it was checked, which was last week, was 130/80. Usually it's 120/60, 65.
So they put you on Toprol just because of a couple points higher? And I don't like messing with medications unless you're on over about 155/95. Okay, there's certain times you want to control that until you figure out, an additional plan. But I don't think that she should be on Toprol, because they're trying to get your thyroid to work. And when they're pushing your thyroid, what does your thyroid push? Thyroid pushes your heart. And if your heart goes too fast, now you got to suppress your heart. And then her cholesterol is not being used. I don't know what this one is. Nabutone.
It's a generic for arthritis.
Okay. What's your worst joint?
My right hip.
So she's on too much medication. Did they x-ray that hip and see if there's any space there or what was going on with that?
Yes, they did.
All right. Did you have a lot of space or not?
I don't know. I wasn't told.
All right. If they didn't tell you, it's probably not important.
I would like some more information.
I would too. I want to know what's going on.
Mm-hmm.
Good. Now, there's her hiatal hernia reflex. That would be her, what is it called again? Protonics. There's her protonics right there. Check. Pancreas, stomach. Hold tight. She's going to be a good one.
Shall I say ouch?
But I know. Positive. Negative. What makes the stomach, what kind of foods make the stomach feel good? Stomach. Duodenum. Stomach.
Yogurt.
Gastrix. Yep. Gastrix, and I want to do that chlorophyll on her. You have any clotting problems or anything like that?
I've had thrombophlebitis, yes.
Okay, so we're not going to do the chlorophyll. Thrombophlebitis. I'm interested to see if this tests for you. Hold tight. Nope. Now, the first thing you got to do is you got to take care of the ulcer. That's the first thing you got to do. No way that you can support your immune system, your hormonal system, your metabolism when your stomach or your digestion is shutting down. Your digestion lays over every system in your body. So when you're using acid blockers or hydrogen pump blockers or all that stuff, foods are going to ferment, carbohydrates are going to ferment, proteins are going to putrefy, and fats are going to turn rancid. So you're just creating more problems down here for the rest of your bacteria that needs to work overboard. Okay? So what doesn't happen up here in these three organs here, you're going to have a lot of gas, you're going to have a lot of bloating, you're going to have a lot of diarrhea. This is what happened. Everything gets pushed down here because this guy up here didn't do his job. That's what's going to happen. So for her, it ain't even allowing it to go down there. It's shooting it back up automatically. So she's got probably a very, very thin lining. So if we threw an acid in her right now, because she probably doesn't have enough, when you don't have enough acid, you can't digest. But her stomach is so raw that she's replacing, instead of hydrochloric acid, she probably has sulfuric acid in there from her meats not digesting, some foods not digesting. Then she probably has phosphoric acid. And there's different acids that are building up that are thinning the lining. So now she's got 3 acids that are thinning the lining, and she should have just 1 strong acid with 3 layers of good, strong stomach. And she doesn't. And that's what happens when you shut down acid in your body. 1. And I'm going to use a Gastrex to stick to everything on the inside of her stomach. Okra, clay. There's a little bit of essential fats in there. And that will heal up that ulcer. Look at that gastrozyme. Yours is the cabbage. Good. 2, 4, 6. So that's the first thing we got to do is we got to heal up her stomach so she can go off protonics. Good. She don't like that one anyway. Let me see the AF beta food real quick. Check her gallbladder. No gallbladder problems. You still have your gallbladder? You made it through?
Of course.
Still have all your parts?
No, I had a hysterectomy.
Good. Put your arms out like that. Hold tight. She's doing pretty well with her calcium levels. Her hips probably suffering a little bit. Took your ovaries?
I don't know.
Did they say total hysterectomy or partial?
They didn't tell me.
Okay, they didn't
I
tell
don't
you.
know.
They didn't tell you much. All right. Now, first thing we got to do is we got to heal that ulcer and stick everything to the inside of that. I'm going to use that gastric capsules by standard process. And there's, where's your sheet at real quick? She's got a bunch of different stuff, but let me check her heart. We don't want to be suppressing you. The reason why we would be suppressing you, if you got a bad hip and you wake up one of these days and you're suppressing your heart, you're going to get real dizzy and real lightheaded, and you might even fall. So we want to watch that topiral as a beta blocker. You're not going to feel your best. Shutting down your muscles with Lipitor and stepping on your heart with Topiral is not going to give her a good quality of life. It's just not going to happen. And she doesn't have enough information to say that this medication is substantial for her health problems, I feel. I haven't talked to her doctor or nothing like that, but with the information she's given me and how many medications she's on, 2 to 3 medications, you're on a drug, more than that, you're on a drug cocktail, nobody knows what's going on in the body. So first thing we got to do before we do anything is fix her stomach. That's the first thing. So that's the one thing I'm going to recommend for her. Is your stomach burning all the way up to the esophagus, through the esophagus?
Not if I stop eating 3 hours before I go to bed, and I raise, I
You gotta
have my
sit
head
your-
propped,
Yeah.
that kind of stuff.
And I don't seem to think, she might have a little bit of a hiatal hernia, but other things should be dropping on you. Ligaments in your feet, bladder, you don't have a uterus. Other things should be dropping that would coincide with this other ligament problem she's having. But I'm not testing very good for a hiatal hernia on her, so she doesn't have one. The beta blocker scares me. Put your arms out like that. Hold tight. There's her heart. She's got a very strong heart. Good, good. Thyroid, there's her thyroid. Positive, negative, so her thyroid's a little bit weak. Let me see that thytrophin real quick.
I've been on thyroid since I've been a teenager.
Okay. Now, do they adjust your medication a lot? How often do you go and get that readjusted?
6 months.
6 months? Have you tried other medications? Like Armour and Cytomel and Synthroid and all that?
Synthroid, yes.
Did that one work well for you?
Yes.
But you're on, why are you on Levitra? Yeah, that's on,
I think that's a generic.
yeah. Can't keep all these names straight. They keep
No, I
on.
can't either. It's the reason I write it down.
Good. You got a pretty good mind. You got a good attitude. 2, 4, 6. There's no reason why she can't get better. And she's a 6 on that thytrophin PMG. I want her doing 3 twice a day. 3 in the morning, 3 around mid-afternoon. Do your hands get pretty cold?
No, I'm warm most of it.
You're warm most of the time. So they might have that medication a little bit high, but the main other thing I wanted to recheck on her was one other thing. I want to make sure your iron levels are good. Hold tight. Good. And we'll work through this, but that's all I do. The major thing is fixing her stomach first. Fixing her stomach, getting her stomach first fixed. Then we could deal with the thyroid. Then we can deal with the nitro and the Do you ever have a heart attack?
No.
You're on a lot of medication for not having a heart attack. Do you have somebody in your family that's close to a medical doctor or something that wants to keep you alive or something, and they're just trying to
I've had several angina attacks.
Okay, so that's very important, but we'll take care of that. I didn't check that, but her heart muscle seems to be fine. We're going to take care of Gastrex for her stomach, and then I want her doing that Thytrophin PMG for her thyroid. And I'll probably see you in the office because we need to do a lot of work. But you're doing good for how long you've been here. She's doing good. Now, does anybody have any questions? Yes.
I have a daughter who is going to be 25 years old next month. She's been trying to get pregnant. She was on all kinds of fertility drugs.
Huh?
And the doctor told her she will never get pregnant because she does not ovulate.
Okay.
Is there anything that
Yeah, the
makes them ovulate?
Chase tree.
What is it?
Chase tree does really well for fertility and helps with ovulation. I don't know, temperature, you could ovulate 3 times, so if there's 3 cycles that we're dealing with in females now, her chances are even better now, because we can hit one of those.
Periods either. She doesn't have periods.
Has she been on birth control and all that stuff before? So you got to watch, in that particular situation, I've been reading a lot on galactosemia. A lot of females don't have the galactose enzyme, and they'll shut down that and too much insulin levels. Those 2 will really shut down a female cycle. So her dairy products might be an issue. It might not have caused the manifestation where genetically she didn't have high enough enzyme. She might just have this much enzyme when you need that much, and that might be affecting that. But I've known dysmenorrhea and not having periods and different things due to milk problems. We should all be weaned off of our milk since we were a kid. We should not be doing milks. That doesn't include soy milk and rice milk because those come from plants. We shouldn't be doing the cow's milk, anything that comes from an udder or breast milk, goat milk, all that stuff. We should be doing mostly the rice, the soys, other different things, depending on your circumstances. But that's what I would support. So that's what I would check. Galactosemia possibly for her if she just hasn't had any periods, and also some type of insulin glucose tolerance test. Those are the 2 things that would be crucial. And then after you avoided that, then we might be able to go and use the Chase tree. to do that. Okay, does that answer your question? Okay, yes.
I went to the doctor, actually started menstruation at 18 years old. I went to the doctor getting consistent cycles.
Okay,
And then actually in the last 10 years, I bleed in between. It's like an old dark.
okay,
Okay. So the doctor kept wanting to put me on birth control pills. They tried like 8 years ago and it didn't fare well. Just recently he wanted to put me on them again.
okay.
I told him it makes me want to kill my neighbor, so I don't want to go on birth control pills. So then he suggested that they burn the uterine lining, which is some, I can't remember what the procedure is called.
DNC?
No, I've had two
It's just
DNCs.
two DNCs. Now, what was the problem? You had too much buildup of the uterine lining? So your estrogen levels are proliferating too much. They're growing too fast.
And then, but there's another procedure where I will no longer have periods, and if
I know what I know what it is. I can't remember. Yeah, it's something with your arteries.
And I said, he just made it sound so great, you know. I'm like, I'll never have a period again. Why isn't everybody doing this? You know, this is wonderful.
I know.
So of course I researched it, and it's not wonderful.
I think what they do is they cut the main arteries to the uterine lining, or cut or burn or stop or something like that. I forget what that's called. I know what that's called. I just can't remember the name of it. But the basic point is the best thing you could probably do is race yourself to menopause. Because how old are you now?
35.
35. There's some things you can try that definitely might be supportive, but the main thing I would probably do is I'd probably give a salivary test on you to see where everything is.
I have another one.
Okay, good. That's probably what I would do, because you've had this, you know, it's so late that you had your period, plus they want to do some additional stuff. You're having some old stuff, old uterine lining, some clotting probably. I definitely start her out probably with a salivary test, because, you know, it sounds like there's more going on than we can really realize or test for through muscle testing. You might want to do that test. Okay, so we'll do that on you. Yes?
I hear your office has had real good luck with Epstein Barr.
Uh-huh.
I have an MD who says once you have it, you always have it. They can't tell when it's better or worse, but yet I can tell when I'm, more tired than other times.
Mm-hmm.
But and I read on the internet you can have reoccurrences, but the MDs don't seem to recognize that.
Right.
They don't treat it. What does your office do with that?
Well, we like to, it's kind of like, if there was a building burning down across the street, what would you do? Call the fire department, You want to try to put that fire out as soon as possible, or do something. Maybe you can save a little bit of it, or, well, as far as what happens in the medical profession with viruses and the liver, they're not doing anything. They're just standing there watching the fire burn. You got to do something to build up the liver. You got to do something to build. There's plenty of nutrients out there to support liver function. They've used silymarin, silibin, milk thistle in Europe for years for liver function, to restore the liver, to heal the liver, even for mushroom poisoning now. So there's a lot of different things that you can do to restore that liver, and plus that liver, you have a huge chance of getting that back, because you can destroy 20% of that liver and it can still grow back. So there's always hope with that, but the main thing we do is support the liver function by helping with the phase 1, phase 2 detoxification, and the best you can do is keep the immune system above that virus. Most of the time, the immune system's, down here and the virus is up here. But that's the main point, and people don't realize that. Weather changes, carbohydrate diets, certain carbohydrate diets, you get in a fight with your husband, certain things happen, then all of a sudden I'm dragging. You got to support the liver, okay? There's a weakness there. If there was a weakness in your thyroid, what would they do? Give you thyroid medication. They don't do anything for the liver. Why are we picking on the liver and doing the estrogen? Why don't we do something for the liver? Because they can, because they'll kill your liver.
So Epstein Barr is more of a liver?
Yes, your liver and spleen. Yeah.
So my brother had a liver disease, cholangitis.
Called what?
Cholangitis, sclerosing.
Exactly. Sclerosing cholangitis, yeah. Yes.
I have a 15-year-old, and she has severe menstrual cramps to the point where she's almost out of her mind. I started very young the same way and ended up with a complete hysterectomy due to that. Is there anything that I can do for her or give her that would subside that. And it lasts for like 3 days, not the first day, not the second. It's 3 days into the period, into her flow, and she's out of her mind.
You got to decide. There's a couple different approaches. Obviously, I talked about the chase tree for PMS. I talked about the bees, the calcium levels, because calcium can control the cramping, especially at that level. Low blood sugar can really change the calcium and cause the muscles in the uterine lining to cramp up. So her calcium levels, her bees, her chase tree, even the progesterone, that's perfectly safe for her because of its source and where it comes from. It shouldn't have any effect as far as detrimental effect. So there's a bunch of different natural things you can do, but then again, when you see this ovulation thing and they're ovulating 3 times, there might be something additional there. There might be. Does she have headaches with that? That might be more where you would incorporate the chase tree for her and do something like that. But I definitely want to check and see. She might need estrogen. There's some females that can't get pregnant without estrogen. So it's not all clear cut. There's some females that don't go through that first cycle that need a little bit raised estrogen because they don't have follicle stimulating hormone raised enough to release the follicle. So most people have problems with ovulation because there's so much estrogen around, but sometimes estrogen is just not sufficient in certain cases. So that's a possibility with her. And that would be another possibility for, if she didn't respond, we could possibly do a test or a saliva test or a blood test or something on that. So yes, I believe I can help her. Last question, yes.
What about irregular periods? I mean, probably up until 6 to 8 months ago, every 28 days like clockwork. Now it can be as late as 10 days late or early as 3 to 5.
Yeah, that's, Dr. Lee coined that premenopause and that perimenopause. Premenopause is 10 to 15 years before you go through menopause. Perimenopause is within 5 years. Or even closer than that. So you're probably getting, setting up that stage. And, no blood test. A lot of blood tests show you high FSH, high LH levels, and they say, hey, you're in menopause. I've seen high levels and people still have periods. So it doesn't make any sense. But that's the clinical one you want to look at. Then, in your particular situation, yeah, you're creeping into something and things are changing. But are your symptoms that bad that you would need something to support that? Like breast tenderness, or is just the inconvenience of the period, or is it the pain?
Very bad menstrual pain, but this is like when you're about ready to give birth, that kind of
Okay.
excruciating.
I don't know how that feels.
And I went natural with all three, so I know what pain is.
I know, my wife went natural too.
So have high tolerance.
Yeah, you're probably heading, how old are you?
39.
39, so you might be heading toward more menopausal problems. You're definitely showing the symptoms. Are you having any hot flashes or anything?
No.
No hot flashes, no irritability.
Oh, yeah.
So everybody thinks hot flash is estrogen. It's not. Sometimes it's an infection. Sometimes it's your thyroid. Sometimes it's low calcium levels. It could be, there's the variability of hot flashes is broad. There's a lot of different factors that go into that. But as far as I think you're creeping into that. It's probably find 1 or 2 things that might help support that. Give that I always give at least 3 to 4 months. 3 to 4 months on that is enough time, to be able to see a change if there's going to be a change at all. Okay? So with the testing, the information, and all the knowledge I have, and all the reading I do, I do my best to try to balance her out. Okay? One more last question.
Tell me about serotonin. Because I thought it was like the greatest thing. I wanted to kill not only my neighbor, but her and everybody.
Right.
It just seemed to be so good.
Right. Well, there are particular cases where it is beneficial, but to be on that medication, I believe, for more than 6 weeks is going to be detrimental in the long run.
How, what is it?
Serafem, the Prozac, derivative for premenstrual dysphoric syndrome or something like that, they made up. I believe that's true, but I believe that might be your estrogen too. So that's not to say, do you believe you have a deficiency in serotonin? or a serotonin imbalance, because that's what they're trying to correct on you. I know you feel better on that, and that, you know, in your particular case, if you're going to kill somebody or do something like that, that might, or you pick up a cleaver or something like that, you know, I tell you, you know, you might want to go over there, and then we'll try to work this out. Maybe we can pull you off this or wean you off this. You know, there's some situations where it is beneficial, but the first thing I'd probably do with you would probably be, the first thing is your B's and your proteins. Get your B's and your proteins up, because your proteins, if it is serotonin, give your body enough protein so it can pick and choose, because that's the neurotransmitters. Your neurotransmitters are made out of all kinds of protein. Tyrosine is for depression, anxiety. There's some things on that works very well. I've seen that case where it does work that well, and it was by a Dr. Daniel Amen on a book that he wrote that talked about somebody just like you that did well on antipsychotic medication. Right. I don't think you have a serious problem, but you know, in that particular situation, that suited your need. So, but I would definitely, after 6 weeks of any medication that's going to involve the mind, the government, the FDA, all these people back off, and it's under your doctor's discretion now. So legally, you're on your own with your doctor. If something happens, something goes wrong, too bad. That's the way it is. That's the way the FDA and all that works. They only really regard a 6-week process to really reset your emotions, get everything going, and then after that, it's up to you and your medical doctor. So they're backing off because there's other consequential problems, because if you were to go off that, you could rebound just as bad, or let's say that, you know, just so happens that the plane took off and your Seraphim was in your luggage and now you're on your own. What are you going to do now? She could have a rebound effect from that medication because her body's used to that. So you could rebound very quickly on that. Do you know what I'm saying? So the best is try to balance that out. But yes, could be used, but to lean on that thing all the time because that made you feel the best. Always, sometimes when you don't feel your best, you're still doing the right thing. Okay? So I don't know if that answered your question or not, but for your situation it worked and it's very helpful. But I believe that there are other alternatives that you can do. Yes?
Dr. Krygier, I've been hypothyroid since 1978. I've been hypothyroid for probably just recently.
Okay.
And that was when I took aspirin. He didn't do something, we were going to get divorced. So then all of a sudden he looked at Jim and said, okay, and started writing whatever I asked him to. Up until now, every time that I have gone to a doctor, and you have to understand, guys, I'm a registered nurse, 23 years nursing experience. I know what hypothyroidism is. I watch it, I diagnosed it in the hospital. And I was so severe whenever I was diagnosed that my reflexes, my knee would stay up for 10 seconds.
Mm-hmm.
First thing they want to do is put you on capsule, antidepressants. Tell them you're tired. You just feel exhausted.
Mm-hmm.
The first thing they do is throw you on antidepressants. It's to get you off in an happy land. Or they used to hand out Valium in the 60s and 70s.
Mm-hmm.
Now the new drugs are antidepressants.
Yep. And they're going to be pulling those drugs in probably about 10 to 15 years because of some reactions that are coming out that they know, just like this hormone therapy. They've been using that for 60 years before this came out.
And you're also seeing it happening with men because the high estrogen levels, they're getting road rage and rage big time. They're putting men on these drugs.
So, you know, we definitely have a problem, but the main point is do the best you can to support yourself nutritionally. I mean, the last road you want to go on is medication. And some people absolutely need it. I believe 99% of everybody can do without it. So there's some situations where you need it, and it is essential. But I'm just a strong proponent in trying to work through things and try to get things done. Whether it's a good social, surrounding, whether it's a specific counseling, whether it's a specific nutrition problem, whether it's a support group through church. All these things are available, and all these things have been known to change the psychology of your mind better than any other medication that I know of. And that research says that. Okay? Other than that, I hope I see you at my thyroid lecture, and thank you for coming.